All right, hello again, everybody. Here is my active learning activity, which is going to be focused on case studies. So case studies are a great way to give real-world problems and ask the students to apply previously learned knowledge to solve that problem. So according to one study, when students have a voice in their learning, it greatly enhances their critical thinking skills, which is exactly what case studies do. So this is a great active learning method because it can be used in a variety of ways for different class sizes and different amounts of time. The purpose of this case study is to teach students about chest tubes, why they're used, and how to assess them, and also how to troubleshoot them with a true clinical situation that could happen to them in the future. Using a personal story allows me to provide rich scenario details that students are likely to remember in the future when they work with chest tubes. So this continuous case study is geared towards undergraduate nursing students, probably in, say, like their med-surg class. This activity would take up the entire class period, and it would be a replacement for a lecture about case studies. So I would divide the class into groups of 4 that I assign as a way to ensure that the groups are academically evenly balanced and to ensure that positive outcome from the activity. So case studies are a great way to achieve the learning outcomes that I posted in Module 3, which I'll go over again later too. Each of the outcomes that I created lend themselves perfectly to become questions for the case study and allow students to answer them in their own words. If they do not answer the question correctly, this activity also is in class, so it allows the instructor to be able to correct any misconceptions that would also benefit the entire class. I'll go through the specific examples of how the outcomes are achieved as we go through the case study, since they will be questions in the case study. So preparation-wise, it can vary for faculty depending on if they're writing the case study themselves or if they're using one out of a case study book. When writing your own case study, additional research is required to ensure the accuracy of information and current best practice, because you don't want to teach them something incorrect. So actually, when using a case study from a book or an online case study bank, which there's a really, really good case study bank online with University of Buffalo, I believe, it's important to be familiar with the case and be able to field any appropriate questions that arise. Faculty should take time prior to the case study activity to provide students with credible sources to find information to answer the question for case study questions as well. If you're using a handout for your case study, make sure that you have enough copies for every student, or make them available on the online learning platform, so like Blackboard or Canvas or Moodle. Students should also complete the assigned readings prior to the case study activity and take the time to become familiar with the sources that the professor has provided. Otherwise, they're not going to be able to participate as well in the activity. So to start off your activity, ensure that students are aware that the case study is coming up so they have time to do the assigned readings. If they're not prepared, the activity may not have the effect you were looking for. And then the day of your case study activity, get started right away at the beginning of class in order to have plenty of time to complete the activity, as well as a debriefing. Another way to save some time is to give your students their group assignments prior to the start of class and ask that they sit with their groups when they get to class. This could be on their handout, once class begins, you want to start your base story of the case study. So this could be on the handout. It could also be on projector screens as you go. Using a PowerPoint as well can allow you to add photos to your case study that can be used for to further the narrative, or be used for questions. So the more details you can provide, the more invested your students will be in the story. This is where real-world situations can be to your benefit. Informing students that this was an actual situation that you had to deal with can also get them interested as well. So I actually did use a PowerPoint that I voiced over, and I'm also going to attach it to this as well. So let's jump into the case study that I put together based on an actual patient that I had cared for. But before we get started with that, I'm going to just review those learning outcomes one more time, just so they're fresh in your mind as we go through the PowerPoint. Alrighty, so those learning outcomes. The first one is the cognitive outcome, which is students will be able to identify at least 3 reasons for why a chest tube should be placed in an acute care setting. The affective outcome is students will be able to revise their chest tube assessment approach based on the patient's age and developmental needs, including physical assessment of the chest tube as well as pain assessment. And then the final outcome is the psychomotor outcome, which is students will be able to assemble the supplies needed to properly check a chest tube for air leaks and to change the collection canister. Alrighty, let's get started here with this case studies. And this case study is called Rice Krispies. So having a catchy title is kind of a quick way to get students interested and involved in the case study right away. But make sure you don't give away the answer to the case study in the title. So like this is kind of a little, if you know a lot about chest tubes or anything like that, then you're already pretty sure what's going to happen here in this case study, but students who have not used a chest tube in the past may not understand it and later might be like, oh, haha, that's good. All right, so let's get past my lame joke. So we are going to meet Carly. Carly is a 15-year-old female admitted to the pediatric ICU after placement of a chest tube earlier this afternoon. You are the nurse coming in for your shift and you received the following report from the previous nurse. Carly has a 4-day history of bacterial pneumonia that was being treated at home with antibiotics. This morning, she was having increased work of breathing and increased chest discomfort that was not controlled by Tylenol. And her mom brought her to the emergency room where a chest x-ray showed left-sided pleural empyema. She was transferred to the PICU where a 20-gauge chest tube was placed and connected to a dry suction water seal chest tube container at -20 of suction. And so far, 100 mLs of drainage is in the collection canister. So we are going to jump right in with some questions, and then I'm going to also just kind of butt in here and there and give a couple explanations as things go through. Before we move on to the questions, though, I did put a picture of the chest tube container actually on here because a lot of times students have not seen these before, and they can look kind of overwhelming because there's a lot of information on the front of a chest tube canister. But giving them a chance to kind of look at it before they would ever see it in practice gives them a little bit more confidence. So let's dive right in with some questions. So Carly has a chest tube to drain the pus that has accumulated in her pleural lining. What are 3 other reasons or conditions that a chest tube may be placed? So a couple answers for this would be like a tension pneumothorax, a large symptomatic pneumothorax, or it could also be used as a surgical drain. And then the second question we have here is, prior to your first assessment, what are some potential issues you anticipate Carly having during your shift? So a couple things that I came up with were pain control, mobility, and then also the potential for self-image concerns. So looking at some of these initial questions, these first few questions address some of the learning outcomes already. You want to start with the first question and give students no more than about 5 minutes to provide answers, like look up some information and then also talk about it. Once they've had a chance to come up with some answers, it would be a good idea to call on groups to share responses. This allows other groups to hear correct answers as well and correct any potentially incorrect answers. The first question addresses that cognitive learning outcome, and the second question, it may be helpful to allow groups to do like popcorn answers because there's a multitude of different possible answers for this question. Having them, like calling on them and letting them just kind of shout out some responses kind of gets the ball rolling here. They also may come up with potential issues that you hadn't thought of yourself, and this is a great example of making the classroom learner-focused. The second question partially addresses the affective learning outcome that I've come up with. Pain is often treated and assessed differently in teenagers than it would be in a toddler, for example. So another issue that teenagers may find worrisome is the potential for scarring from the chest tube that could cause body image issues. So once you've reviewed these first few questions thoroughly, you can kind of move on with your case study. And just another thing to point out, having all the groups do all of the questions rather than letting groups divide questions up, like saying group 1 does question 1, group 2 does question 2. Having them all do all of the questions can help with retention, because if they're not having to look up that answer, if they're not having to write it down even, they're not going to remember it nearly as well. So, all right, so once we've reviewed these first couple questions, we're going to go on. So when you enter Carly's room, you find her resting comfortably, scrolling through her phone, as teenagers do. You introduce yourself, do a quick scan of her room, and then begin your initial assessment. So what's next? You notice a bag of supplies attached to the end of Carly's bed. These supplies are emergency equipment if the chest tube were to come out accidentally. What supplies should be included in this kit? So answer to this would be hemostats ×2, Vaseline gauze, 4x4 gauze, Tegaderm large enough to cover the insertion site and gauze, and then some extra tape. And then if you wanted to, too, you could take some time to explain why these different aspects are required, or you could incorporate them into the case study later as well, depending on how your case study is going to go. So next, you assess Carly's lung sounds. What lung sounds would you expect for a patient with pleural empyema? And the answer to that would be diminished or possibly even absent lung sounds over the area that's affected. It could be coarse, crackly lung sounds as well. And then this is a good time to kind of pull in that this kind of question helps pull in knowledge learned from other classes, which is a great part of case studies, is that you're incorporating multiple courses and stuff like that into one large activity. So this kind of pulls things in from like physical assessment or their fundamentals class. Alrighty. So you also assess the chest tube insertion site and collection canister and determine that everything is in working order and leave to attend to your next patient. So again, you can kind of determine how you want your groups to answer your questions. You can give them time to work in their groups to find the answers, or you could have them kind of call out the popcorn answer kind of thing as well. So 45 minutes after your initial assessment, Carly presses her call light and tells you that she's having a lot of pain. So how would you best assess her pain? So this is, again, kind of another good question that pulls in the pediatric aspect of this. Because she's an older patient and she doesn't have developmental delays, using things like the basic number scale for pain is probably appropriate for her. But if you wanted to, you could also say, what if she was a toddler? Using something like the Wong-Baker pain faces scale might be more appropriate. So Carly tells you that her pain is a 7 out of 10 around the insertion site. You report this to your attending physician who writes for pain medications. And then again, here we go, pulling in things from other classes. This is a good pharmacology question then. So what methods of pain relief would be appropriate for Carly's pain? So something stronger, like a stronger pain medication like morphine or Dilaudid would probably be more appropriate for the severity of Carly's pain at the moment. Another aspect that you could bring in here is that she would be a pretty good candidate for a PCA pump because she's old enough to understand it and able to operate it on her own. A couple other ways that you could relieve her pain would be repositioning or changes in her environmental conditions and such as well. So moving on, you administer the ordered dose of pain medication and you get an order for PRN doses as well throughout the night. You come back 30 minutes later to reassess Carly's pain, and she rates it at a 5 out of 10 now, but says she's still very uncomfortable. So you assess her chest tube and the collection canister. So how should you assess her chest tube site? Again, kind of pulling things in from the pediatric aspect here. Because she's older, it would be a good idea to explain to her how you're going to assess the site. Let her know that you need to raise her gown up to check the tube site and the dressing around it. And that you'll need to also press on her chest in the area around the site. So this one also fulfills that affective learning outcome by adjusting your assessment techniques based on the patient's age. All right, now we're getting into the fun part here. So when you press on her chest, you feel a popping sensation like Rice Krispies. Looking at the canister, you notice intermittent bubbling in the water seal. So what do these findings mean? So the finding here is that there's an intermittent air leak somewhere in the system. So then what do you do next? And I'm sorry, I couldn't help myself. I love the Finding Nemo gif. So what would you do next? So you would momentarily clamp the patient's chest tube close to the patient and observe the water seal. So if the bubbling stops, that means the air leak is a connector issue or is from the patient's chest. And then if the bubbling continues, it means that there is a leak in the system somewhere which requires replacing the system. So the bubbling continues when you clamp the chest tube. You notify your charge nurse and your attending physician who orders for the system to be changed out. So time to switch things out. What supplies are needed to exchange the collection canister? Answer to this would be you want that hemostat. You need a new collection canister because you're not going to just reuse the old one because there's potentially something wrong with that. And then you'll also want new suction tubing. And then we can move on to the one of our last questions here, which is how do you exchange the canister? So answer to that would be set up the new canister prior to clamping and disconnecting the patient. So, make sure you get the water in there, make sure you have your suction tubing all connected correctly. Everything should be all set up and ready to go before you clamp or disconnect the patient. And so the next step then would be only momentarily, clamp the chest tube close to the patient, disconnect the system from the chest tube, quickly reconnect a new system, and then unclamp the tube.
So these last couple questions fulfill that psychomotor learning outcome that we talked about earlier as well, which the switch goes smoothly and the bubbling has resolved. So Carly is able to rest overnight with the occasional pain medications on top of some scheduled Tylenol. Her chest tube drains out another 65 mLs of drainage overnight and then drains out less and less over the next 2 days. The chest tube is pulled and Carly is discharged home the next day. So leaving a little bit of time at the end of the activity as well is also important to answer any unresolved questions and to give students a chance to reflect on the activity. Asking a couple final questions like, how do you think the situation was handled? Or what would you have done differently if you were their nurse? This can lead to some final discussion, and you should always leave a little extra time at the end to go through this discussion, because this is where you can get some really great ideas. Reviewing the major points from the case study is also a good way to wrap up the case study and ensure that students are taking away the important information. And then here's just some websites and such that I got pictures from.
So case studies are great because they can be used in all kinds of settings and with different group sizes or even individually. The case study we just went through was clearly for a didactic setting, but it can also be adopted for an online class, whether in a synchronous manner where students all log in at the same time, or in an asynchronous pattern where individuals or groups work on the case at their own pace. So putting more emphasis on the PowerPoint aspect of the presentation and using voiceovers is a good way to adapt a case study to an online class. Case studies can also be a great way to finish out a clinical day in post-conference. They could be shortened down to fit the time that a clinical instructor has available and can be focused on specific points that they want to reiterate to their students. So it could even just be something that happened during the day today and then just adjust it a little bit. So case studies are extremely flexible. Case studies are also very open to variations. They can be used to also address cultural competency in student nurses by including a cultural aspect of the story. Actually, this patient that I had was a Jehovah's Witness, so they had to follow the bloodless care policy. So if you had more time or if you wanted to focus on that cultural aspect, you could include something like that in there. Certain parts of the case study can also be adjusted to help students learn empathy in a controlled environment. Case studies can be customized to make whatever point you want them to. There are multiple research papers all about the use of case studies for allied health sciences and the positive effect they have on information retention, as well as the development of critical thinking skills. Many educators use the case study method due to its tried and true results. There are 2 learning theories in particular that support the use of case studies. The first learning theory is cognitive learning theory, which focuses on meaning between what the student already knows and what is new. It's this blending that works so well with case studies because you're using what you previously learned and applying it to a new situation. The second learning theory that works extremely well with case studies is situated learning and situated cognition because it occurs in the context of the real world. They usually include open-ended questions that require investigation through multiple sources, collaboration with others, and individual and group reflection. So, ta-da! Case studies. This whole learning theory is pretty much just case study. I know it was a long one, but I hope that you guys hung in there. I've always loved case studies because they're like a little mystery that you get to solve by getting new clues as you progress through the case. And then just to kind of finish up on a fun little tidbit, one of the articles that I used was actually written by my mom. She and one of her coworkers worked and wrote a case study book for allied health sciences and then did some research as well at my alma mater on which kind of case studies work best. And their research had found that clinical studies based off of personal stories, so like the one that I had here, with rich detail rather than just a clinical situation, were better retained by nursing students. And it was actually nursing students that did the best with this because they did this with nursing students, pre-med, pharmacy, and I believe exercise physiology was in there as well. So this ties in with narrative pedagogy working well for nurses as well. It's that personal, true story that are the ones that stay with nurses and should be encouraged in many aspects of nursing education as possible. They also found that nurses really, really grew with empathy using case studies as well, which is clearly super important for nursing. So a lot of cool research there, and it just kind of thought it would be funny to throw something in there that a little personal to me. So, all right, I am finally done. Thank you for sticking around to the end, guys, and I will see you soon.